Premier of Ontario kicked a hornet's nest by suggesting he could fix what ails Ontario healthcare by introducing private delivery. That has ideologues lined up on both sides. But how private is our existing delivery? And when we debate public care, are we clear about what we're debating? Dr. Brian Day has been advocating, including in court, for private delivery in our system for decades. He's an orthopedic surgeon and medical director of the Cambie Surgery Centre. Thanks for being with us.
Oh, you're welcome.
So the distinction that I want to make here is between what's public and what's private, because, of course, Brian, a lot of our system now is private already. My doctor is a private, contractor to the system. The public pay is the important part. Do you think we're kind of getting lost in the vernacular here about how new systems will be delivered?
Yes, I mean, what we have to do is we need a much bigger change because, as you rightly say, pretty well every doctor's office in Canada is a private delivery, and the NDP government in BC has been contracting out surgeries to private clinics for more than 25 years. Well, the big thing we have to do is end the state monopoly, which is unique on the planet, in which the government has eliminated all competition. But so we're the only country in the world where it's illegal to get private health insurance. We have these arbitrarily exempted things like prescription drugs and ambulances, and in many provinces, physiotherapy, dentistry that other countries cover. So, and we're now ranked, when I came to Canada, we were fourth in the world in doctors per population. Government policies have put us down to 69th. We were 8th in hospital beds. We're now 30th. This is what you get when you have a monopoly with no competition.
So the UK is the one, of course, we would compare, I think, most closely to, and they do have, as you say, an option to get private health insurance and access a private system. The big concern often raised is it'll siphon off doctors, nurses, resources from our public system into a private system. How do you address that? And can we address it when we have a shortage of some of those things?
Well, it will, we have 78 surgeons that once they've used up all their public rationed OR time, visit and come to Cambie to do some procedures. 23 of those 78 would not be in Canada if it were not for the additional operating time we give them. And there are over 1,000 nurses from Ontario working in a single Detroit district because they're being driven away by this dysfunctional health system that is not serving the consumer. We're the only country in the world where a patient going to a hospital, even within the public funding system, uses up the annual budget. That means hospital CFOs do not want patients because they'll come in, they use up the money.
So we only have about a minute left here. You're talking here about changes that sound logical. We see them working in other countries. I'll point to the UK again, if people want to kind of look up the comparisons. Is it easy to adjust? Are we too far down one track? Or could we actually make this change so that we actually can introduce the innovations you're talking about and continue as we are, which is with universal care?
Well, I use the hockey analogy. We are ranked 10th out of 10 universal rich countries that offer healthcare, 10th of universal healthcare. And if you were the 10th ranked hockey team, wouldn't you look at the top 2 or 3 and try and copy what they're doing, especially when you're spending more than any of the others are on healthcare? So we need to look at New Zealand, Australia, Sweden, Belgium, Germany, France, countries that just outperform us in every way and have universal healthcare, and none of them operates under a state monopoly.
Dr. Day, so good to have you with us. Appreciate your time.
You're welcome.
Brian Day is medical director of the Cambie Surgical Centre. Time for the takeaway and the need for a chat. This week, Microsoft said it will invest another $10 billion in OpenAI, the artificial intelligence firm behind the new sensation, ChatGPT. That's the AI that can write essays or songs or just about anything you like if you're not overly fussy about accuracy. Maybe you think the partnership between the world's largest software company and the leading inventor of artificial intelligence is none of your business, but maybe it should be. Still in its infancy compared to what it could do, think HAL from the movie 2001: A Space Odyssey, and you get closer to the end goal. AI in the meantime is being used in all kinds of software to make it function better, and everything from facial recognition to digital assistants like Siri are simple forms of AI. While the folks at OpenAI have had a commitment to keep their version of machine learning on the side of the angels, it's hard not to see this transaction as a deal with, well, not angels anyway. Microsoft is about Microsoft, in the business of selling things and, when it can, dominating markets. This is the company that was sued for using its monopoly power in desktop operating software to try to dominate competition for new types of software tools. Maybe it learned its lesson and the giant has been reformed. And of course, even with OpenAI in its arsenal, Microsoft will face competition. Rivals like Google are working on their own versions of artificial intelligence. But the agreement raises a bigger question. Given how little most of us understand about the depth and potential of this technology, perhaps now is the time to be asking questions, not only about the good it can do, but also the potential for harm. And since both of those are somewhat unknowable until they already exist, we may want to go even further and keep this technology out of the hands of entirely for-profit entities, with more oversight than we would normally require from a software maker. My takeaway? More oversight of who owns AI may sound scary to some, like suggesting centrally planned innovation, but it's really more about avoiding a future where we try to put the AI genie back in the bottle, but we don't even know how to write the code. That's Taking Stock for this week. I'm Amanda Lang. Thanks for being with us.